All right, welcome to the Aspirational Care Advisors Group. We are glad to have each of you with us today, and we've got a few new faces. I'm going to give a few of you a chance to just give a quick introduction. Ray, do you want to introduce yourself?
Yeah, hi, I'm Ray Markman. I've been in corporate life for a long time, and at the same time, that was my daytime job in the advertising business, the marketing business. Head of several companies, and I started at nights and weekends. I started 9 companies and took 4 public.
Nice. Well, welcome. We're glad to have you aboard.
Thank you.
Jared, I don't think you've introduced yourself, have you?
No, I haven't.
Please introduce yourself to this group. Jared and I had a chance to meet about a month ago.
Yeah, it was a great visit. So my name is Jared Briggs. I am in the Utah area, also Wyoming. My office is actually in Wyoming. Been a licensed health, life, and Medicare broker for 6 years now, and work with a lot of individuals, business owners, small businesses, doing group policies, but mainly the individual market for health insurance and Medicare, and then all the things in between. Anything else you want me to add?
Well, I did not know a lot about the individual market, and was very educated by Jared as to the nuances and how to really leverage the individual market to make it work in a lot of cases, especially small employers. I think a lot of people don't even understand and appreciate how well, if you just navigate it right, it can be a benefit to a lot of people.
Correct. Actually, there's a business getting ready to launch, partnership starting, and they're both quitting their jobs, investing, starting a business. And their big question was, they're like, hey, we're going to start hiring employees. You helped us with this individual health insurance. Can we just do the same thing for our clients, or for our employees? And I was like, yeah, of course, we could just do the same type of thing. So they were really happy because they both come from companies. It was like $1,800 a month for their health insurance. They're like, there's no way our company could afford that for every employee just starting out. And I was like, I get it. So,
well, and I think most people have the impression, I know I did, that the individual market is just not a good place for anybody to go. And that's just not the case. There's clearly some people it's not very good for, but a lot of people that you can have a lot of advantages by going to the individual market. So.
Correct.
Well, I'm going to go ahead and we've got a lot of people jumping on right now. So instead of trying to go through everybody in introductions, I think I'm going to go ahead and let Jay get started. Jay's actually a member of this group and has been participating for quite some time. And he and I had a conversation a few weeks ago. And I said, Jay, I really think this group needs to hear Walmart strategies. Walmart Health is doing some pretty cool things, and I love their mission. I want to make sure Jay kind of includes that in his presentation, but I want everyone to have a chance to learn about what Walmart Health's doing, but then get a chance to ask Jay questions. So Jay, do you want to take it from here and run with it?
Absolutely. Thank you so much for the opportunity to come back in and present. I know a couple of you have seen some of the presentations that I've given before, Jeff and Nelson, and a few others, wow. Steve. So I appreciate your patience as I go through this again. And what's really interesting, I think you said it really, really well, Daryl, is that we're still learning as an organization. So you know what? Hang on, trying to share my screen, and I'm not sure which one is going to be. So the great thing about what we are embarking upon, and I'm going to, all right, I want to make sure that I go big so you can see it. All right. Do you see the big screen?
We do.
Excellent. Boy, I chose right. It was like a 50-50 chance because I have a couple of monitors. Just real quick, as by way of introduction, my name is Jay Hoffman. I'm the director of Walmart's Health and Wellness Sales Organization. Interesting enough, the sales organization is just now over a year old. The idea came from the fact that there was an identification that the products and services that we do provide have availability to bring into, we'll call it that employer space, health plan space, association space. Walmart, you really created Walmart Health just a short few years ago. And when I say few, I'm talking about, I think it's 4 or 5 years ago. when there was a decision made that Walmart Health and Walmart Health and Wellness now really needs to have a separate focus outside of the leadership when it comes to retail. So they went about and hired and created executive level status. So the EVP of our organization reports into the CEO with the sole focus is how to leverage our footprint, our digital capabilities as a way to help drive down costs, increase access, but still be able to provide high quality care through the things that we do today, along with, as part of the strategy, is what should we pilot, what should we purchase, what should we build, or who should we partner with. And a couple of those things that have happened most recently, and I'll go backwards just a little bit, which is the acquisition of MeMD, which is a virtual healthcare company that took place almost 2 years in June. And a more recent example of partnership, which is with CareSource, where they're doing doula for Medicaid populations that we are working with in an effort to help, again, do the things that we want to do with our strategy. So I'm going to go to the next slide, and I'll let you read it. I'm not going to read the slide to you. There's a lot of information in there. However, what's so unique about what we do as Walmart is that when you think about who we are and where we are, when we have 190 million unique shoppers every week, we're well placed, and we're a brand that people know and people trust. And despite the fact that there are we are Walmart, or the Walmart People websites, which is kind of funny, that we take what we do very seriously, and it really comes as a result of Sam Walton's initial mission, which is he wanted to build something so that people can save money and live better. That actually extends into Walmart Health and Wellness, is how do we continue to offer those type of savings so that people can live better and healthier lives. And that's why we have been on this initial journey as Walmart Health and Wellness. And we haven't stopped working on improving, expanding, and growing our services in such a way that it actually makes a healthy impact on individuals. And when we talk about Walmart Health and Wellness, we really talk about an omni-channel approach. And this has now become kind of a mainstay word. It's out in the marketplace. But when you have a physical store that you can actually do services in, as well as now a digital front door, and that digital front door is going to continue to expand as a result of us investing into the Epic EHR platform, along with our virtual care services and other things that we look to do with even is something as simple as our Walmart Plus card, that we see an opportunity to help address a wide variety of people out in the marketplace, all in an effort that if we can offer some of the basic tenets of healthcare that people can use to keep themselves healthy or get themselves healthy, then we've accomplished our goal. We realize that we are not the solution that healthcare needs to take on, but we want to be a part of the solution. The type of work that Nelson's doing, that Daryl's doing, that Jeff is doing, and others that are on this call, and looking for every single avenue to break down and break apart what they've referred to, and I buy into 100%, are the cartels, which is driving healthcare through the roof and causing lots and lots of pain. And I'm sure if all of you read so much like I do, it's amazing how bad it really is that no one's really still from the federal government or even at state governments trying to figure out how do you overcome some of this, other than some select states like Ohio, or some of the work that's being done by the federal government around PBMs. But what we see is an opportunity to do what we do best, which is serve our communities where we are. And when you think about 80% of counties across the United States are health deserts, we actually have stores that are located in those deserts, more than likely. So we're continuing to look and find ways to make sure that we can be, again, a part of that solution, so that those Americans with more than 50% of Americans carrying medical debt, and the most recent report recently, which is 78% of Americans are living paycheck to paycheck. Blows my mind every time I look and see those stats. But again, we're here to help serve the communities and the people across the United States, because at the end of the day, we're not altruistic. We are interested in making, a profit, to be a profitable business, but our communities are what help us stay afloat. And one of the core tenets of what we're doing and how we're moving forward with health and wellness is really keeping a focus and an eye and building solutions around the social determinants on health. Something that's not always talked about, or it's talked about in a very kind of 60,000 foot level or 60,000 foot level, versus what does it actually mean? What is it actually doing to communities, as well as to the cost of healthcare? When you think about so many people that don't have access to primary care, they don't have access to nutrition, who have other factors that weigh in on that social determinants on health, that actually affects us. I am going to use a retail comparison. If you have people that are going in the stores and stealing product all the time, that cost ultimately does get passed out across all customers that go to a particular store or any of the stores. So when you think about the social determinants of health and people are starting to get not just one chronic disease, but multiple chronic disease, and they're not paying their bills, and they're going to the ERs for simple sicknesses that they could be taken care of in other ways, that actually has a direct input on what happens with our healthcare cost. So we see this as a great opportunity. And part of what we like to continue to focus on is, how do we help when it comes to food security? How do we help social determinants on health factors around maternal and infant health, as well as cardiometabolic disease? And so we do that through a few of the services that I'm going to touch on today, because I don't want to bore you to death. And I know a lot of you are probably looking at this being your last hour to jump into the weekend. So I'll try to keep this light and keep it quick. But we'll just talk about virtual care. Pretty simple. It was really the first step in that digital front door, as I mentioned to you earlier. And what can we build around it and build in it to be able to extend the reach, to be able to extend the value, to extend the type of care that people need when they are in their home, in their car, or at work, that makes it more accessible and easier to get what they need, whether that's a primary care visit, an urgent care visit, or behavioral health, and a couple of other services that we provide. And there's a slide I couldn't find for today that was developed, which is a pretty simple synopsis that said, listen, when we have a patient that comes to us and has an urgent care visit, once that urgent care visit is completed, we ask them two questions. How did we do? How was their care? And the second question is, where would they have gone otherwise? And I think this is a really important point to make for you all, because as you start thinking about virtual care as kind of a throwaway item right now, I think it's an opportunity for you to start focusing on how do you actually use and leverage virtual care, whether that's Walmart or some of our other worthy competitors. Is the answer to that question about where they would have gone, 9% would still go to an ER. Still blows my mind. 36% would go to an urgent care center, and 36% would try to go to their PCP, and then there's a breakdown for the rest, and including about 10% that would just not seek care if they didn't have virtual urgent care. When you apply that across 1,000 people and the cost to what it would have taken to actually go to these brick and mortar solutions is like $600,000 over or more in savings for 1,000 people that would have went to that brick and mortar. So I want you to process that for yourself, because that actually, again, impacts healthcare costs and actually impacts the healthcare plans, because all that spending just goes right back in and is what is considered for next year's 4, 6, 8, and 10 and 12% increases to the health plan cost. Again, very lightly, what we're super proud of is that we have live care coordinators, and that's really the piece I wanted to focus on with this slide and the next, is that not only do we have providers that all are NCQA credentialed, but we have 365, 24/7, US-based care coordination to help these patients before a call and after a call for any of the needs that they might have related to the appointments that they have. And we think that's really, really important, because at the end of the day, the patient needs to know what's going on. They need the support. And if they need more directions, whether it's prescription, a referral, or a referral into a network, or referral out of a network, we're actually able to help them to do that using really well-recognized tools to give them the proper guidance. And I'm talked about this lightly. I'm going to move on. And I talked about the care coordination. I think what's really great is that I think one of the best things about the reason why our patient satisfaction rates are so high is not just because our providers are so well taken care of, so they take care of our patients, but also because our care coordinators take care of our patients as well. And then let's talk about pharmacy. Walmart is one of the largest pharmacies in the world. We are not a PBM. We are not ever going to be a PBM. We're not doing discount cards, because we work with all the PBMs. We work with the companies that offer discount cards. But what we do that might be helpful for advisors that are in this group, or employers that are in this group, depending upon the size of the organization, we can actually do a couple things. We could do on-site pharmacies if the organization is large enough and has a large enough population that we can actually bring pharmacy into that place of work. And we have some of the biggest names that you would recognize that already do that with us. We could also do direct to employer pharmacy contracts. We actually can say, listen, and we've been doing this for a while as well, is we know what our costs are. We put a fill fee on top of that, and there's your contract. But the employer just has to find the right PBM, PBA, or whoever can actually adjudicate the claims. But we do that today, and that can save a tremendous amount of money, because you're no longer having to work with other third parties to create those contracts. Those contracts you can actually do with us. And on top of that, we also have specialty pharmacy. And specialty pharmacy is something that we've been doing for a short period of time in different ways. But where we're at in our journey with specialty is growing tremendously. And it's the growth is actually coming from how do we help the individual patient to support their needs around their specialty pharmacy prescriptions, whether that's the clinical services that we offer, the affordability because we're doing the contracting, the type of analytics that we're doing to help the individual employers understand what they're paying for. But we've also built things like centers of excellence. We do a Care Live line that offers 24/7 clinical support with nurses on the line. So when there's questions or concerns or issues, that we're able to help our patients directly. Again, it's that patient care, that patient touch, or that patient care that is so effective. And I think that when we talk about various solutions that are offered in the market, such as nurse navigation, those are very impactful and they're meaningful to the patient and actually do great things for those patients to actually manage their care. And the other things that we do is, how do we reduce the barriers? We can deliver pharmacy to someone's porch. If someone has specialty care, we could deliver to the porch, or we could deliver to their local Walmart pharmacy. And we also do mail order. So we try to make it as easy as possible for everybody. And we've been doing this now for a while. And all we're doing is getting better and better, because as we continue to grow, we continue to learn, and we see that there are new ways and new things that are required to make sure that we're able to meet the demand and meet the expectations ultimately of our customers. And then we have other things such as the employer immunization program. While some of other companies have given that up, we still think that it's incredibly important to consider a vaccination program that exists maybe outside of that health plan for consideration, because we can actually do on-site clinics at the workplace to make sure that there is compliance. We can do immunization voucher programs. And when based upon levels of like 1,200 employees and more, we actually can offer pretty steep discounts over what a health plan might be able to deliver when it comes to the cost of that immunization. But also think about this. Depending upon the employee mix, maybe you offer a shingles immunization program. Maybe it's the flu season, you want to do a flu vaccine on site. These are the things that we would love to be able to work with you on and work with employers on, because we think that immunizations is still critically important with or without the a COVID consideration. But these are the things that we still are interested in doing. We also do pet RX. We recently signed an agreement with a new partner, which is Nationwide Insurance, where people are able to actually get their pet RX at super steep discounts. I don't know about you, but I and my wife have a dog, and we're prior to working for Walmart, we've been trying to be very clever shoppers on how to get her medicines at a better rate than you can find at some of these we'll call them chain vet stores and vet clinics. And I'm going to tell you right now, this has been a really, really interesting new program that we've released into the market, and already starting to see how the uptick in taking this on, because pets are family members, and unfortunately, they're expensive. And then direct to spend, our direct to spend program, pretty straightforward. This is really a way for health plans, for employers, really to help address SDOH. The direct to spend has really been a program that has such great foundations, and all we're doing at this particular point is growing it. How do we continue to grow it in such a way that we're actually able to help employers, health plans, and so forth address those employees, those individuals who need that extra help because the money just doesn't go out far enough, or doesn't go far, the money doesn't go far enough to be able to take care of some of these basic needs. With the idea in mind is that no one has to choose between food and medicine or rent, that with direct to spend, that we're able to actually help to offset that concern. And we also have a prescription safety glasses. Simple program. We use a really great client that helps us to bring this particular program into an employer space, so that the people don't have to wear goggles over top of their glasses. They can actually get prescription safety glasses fulfilled at your Walmart ophthalmology and glass shop. And then getting close to the wrap up here, I think one of the best things that I'm so proud to talk about is our community health worker program. And this community health program, health worker program, is something that we are expanding on. It's an investment. These are not revenue producing individuals. These are people who come in, work with the community resources where a Walmart store is, to help individuals who come in and ask for help get the help that they need. We do things, as you see on the slide right now, help to generate awareness of the resources that do exist in a particular geography. We help them with scheduling appointments for doctor visits or specialists and so forth. We help them with the application process when it comes to food stamps and utilities, where there are grants that are available through the Walton Foundation. There are ways for the community health workers to assist people to find ways to offset the struggles that they're going through. But we see, again, it's our way to help service our communities, and we see the community health workers as a way also to make sure that our community members take full advantage of what it is that Walmart's able to do, as well as what is available out in the marketplace. And then when you think about us, we're really just, a company that saw that we already had so many tools. We already have a footprint. We have a physical presence. We have a digital presence. And we also have an analytical presence. And in that analytical presence is growing in such a way that we see this helping to drive even more detail into population health activities, activities around value-based care, taking on risk models, and doing things, again, that we, when we think about the communities that those stores are in, these are also the communities that our associates live in. And when I share with you that we have 1.8 million associates like myself, we think it's really, really important that they're taken care of. So that's the end. So I'll stop there, Daryl, and I'm open to questions.
So Jay, I know we've got some questions already keyed up, but I've got a couple of things I'd like you to share because we've talked about them in the past.
Sure.
And I want you to add them to your presentation. And that is aspirational healthcare, primary fundamental principle is relationship-based healthcare. And I love the fact that it's, even in your virtual with it is spread out as you are, it's relationship-based. So please share that. And then you're dropping in those prefab clinics and your goal to have 75 this year. I'd love for you to share that strategy too.
Sure. Well, let me start with the relationship piece. Well, let me tell you what, let me start with the health centers first, right? Because there's a purposeful, not to necessarily talk too much about the health centers in the presentation, because everybody wants to talk about the health centers, which is great. And I really appreciate that. Our health centers, so we're, I think, at 33, 34, because we just had a couple more open up. By the end of our fiscal year, we should have 75. So we're going to continue to expand in the 5 states that we're currently in, which is Florida, Georgia, Arkansas, Illinois, and Texas. We're going to continue to add health centers in those particular areas. But when I say that, they're not. So if I say Dallas, people gotta go, oh, why are you doing in Dallas? No, it's not really Dallas. It's a town that's about 20 miles outside of Dallas that does not have primary care. It's like Cartersville, Georgia, Dallas, Georgia. If I say Orlando, people kind of go, oh my God, it's Orlando. Orlando has it's around the Orlando area, and it's actually, Orlando's like Phoenix, has a significant shortage of primary care physicians. So we're looking to address those markets where there's a lack of primary care. We're not interested in going head to head with primary care clinics that are already existing. If there's a need, that's what we ultimately want to do. We do plan on continuing to that expansion, which is going to go into Kansas as well as into Arizona over the course of the next year. And unsolicited, I have a couple of folks that have gone to our health centers because they wanted to see it. They were just very, very curious. I made the arrangement. I didn't go with them. I gave them my card. I said, ask for the center manager. They would give you the tour. So completely not prior arranged. They were going to go on a particular day and bring my card. So I tell you, the emails that came out after that, it just excitement about what that center looks like. They really thought they were just going to walk in and look at something that looked like a Walmart store. And they're like, no, it's big and beautiful on the inside. They got to meet staff as they were walking along. They got to meet the community health worker that was working there, along with the physician. They got to see the dental lab. So not only are we able to do general dentistry, we can actually do partials and so forth. They were pretty excited, but the one thing that they all glowed about is when you walk in, you see the prices, the full transparency of those prices. So you knew what you're going to pay as soon as you walked in. And I said, absolutely, it is about transparency and it is about low cost. So we're not so proud of our centers that we charge more for. We're charging what, is, we'll call it, as best of a cash market rate that you can find. So and some of the questions are, can we do physicals there? And the answer is, of course. Can we do contract? Can we use the health centers, through a contract? The answer is yes, absolutely. But also just as a way to say, it's not everywhere. It's only 75 locations. The plan is to continue to expand, but we're doing this in a very thoughtful and strategic way to help address, again, those areas that we see the need. Now, as it pertains to relationships, there's a couple pieces I think that are important for me to share, and I appreciate that question, Daryl, and that is this. So I'm going to start with the pharmacies. We're doing more and more work in an effort to take all the administrative work off of our pharmacists so that our pharmacists actually can do more at the top of their degree, which is patient care. And when you think again about where our pharmacies are in those health deserts, our pharmacy actually becomes the community pharmacy. Now, granted, it's not an independent pharmacy, and love our independent pharmacy networks that are out there, but we become the community pharmacy. Our pharmacists know the patients when they come in. They use the Epic system to continue to chart the progress, the medications and so forth, and anything that goes on with that patient, we are there to help support them. On our health center side, same Epic platform, same primary care doctor. That could be your primary care doctor as long as you want to go, because those primary care doctors are employees. They are Walmart associates. They are there to actually grow a practice, to grow their panel. And as their panels grow, we'll hire more primary care doctors to make sure that their panels are very well balanced so that they can give as much attention as needed to their panel of patients. And then with our virtual care, we have two specific service lines that offer a direct relationship. One is our primary care. The other is with behavioral health. When a patient comes into the system, into the platform, in either one of those services, they actually get to choose the medical provider, the DO or MD. There's a list that they get to choose from. And they can choose whatever doctor that's going to continue to work with as long as they have that service. Same way with behavioral health. They're all master level, licensed therapists. They get to choose the therapist that they want to work with, and they can stay with that therapist for as long as they want, building those relationships, building that trust so that they can help that patient manage their care and be a part of their pathway moving forward.
Nice. Thank you, Jay. Appreciate that. I've got a few more questions, but let's go to the ones that have come up in the chat first. So Timothy Spooner asked, what is the MSK strategy, or is there a component for MSK, musculoskeletal?
So great question. So we don't have an MSK tied solution.
Okay.
In other words, we don't have a partner and we haven't built anything around MSK. We think the MSK is really important. And the reason why I say that, I'm going to take a step back. I'm going to talk to you about as I'm a Walmart associate. We have centers of excellence. We were the prototype for Edison Healthcare to create because Tom Emmerich was an employee and worked with Walmart to create these centers of excellence in an effort to make sure if someone needed surgery that they were actually going to get the surgery because they had a second opinion. So we see and know the impact of why MSK and having that solution available. At this particular point, what we do is that if there is a need, we will take we use Healthcare Blue Book as our way to help people navigate to, with referrals. and I'm going to be very transparent as always. We will say, what's your zip code, or what zip code do you want us to use, whether that's work or is at your home. We offer to them the healthcare blue book, and we have the full robust offering from healthcare, so we can tell them the grades of that individual, where they're located, if they're in their network or not, all in the goal is that we're giving them the best consult as possible. We do realize that our patients have a tendency then to go home and talk to their neighbor or their friend, and they may go somewhere else. But we do our best right now to use the healthcare blue book to do that. There are conversations around steering patients to the right places, but at the end of the day, the patient still makes their own decision. Are we looking at MSK solutions? The answer is simply yes. That's all I can talk about, unless we all want to sign NDAs.
Another question that came in, Jay, out of 100 employees or adult members, how many would use the virtual in a year? Do you have any utilization based on like population numbers and how many actually use it?
Yep. So my reps and other people that know me so well love this answer. It depends. So if you take a look at national averages, and by the way, if you're all aware, there's something called the Fair Health Report, and it really kind of talks about national trends if telehealth usage is up or down. What we have found is that, when COVID hit, man, it spiked. It was used. It was used like crazy. Post-COVID, even though we're still kind of in that quote unquote post-COVID, it went down. But we're starting to see that people that stopped using it, took a year break, they went from having telehealth as a necessity to now it's more of a convenience. And it's also because of a new necessity, which is I can't find a primary care doctor that will take me. So we're starting to see utilization rates go up. And then the other part that depends upon all this is, how is the employer engaged with their employees? How's the broker or advisor engaged with helping engage with his employees to always keep virtual care as that option top of mind, especially around urgent care, and reminding people if they need a behavioral health assistance or even a primary care doctor that is there and ready and available. Those employers that are engaged along with their advisors' engagement, and we're willing to help support that, significantly higher utilization levels. And we want our services to be utilized because we know the positive impact that it has for the individual as well as for the employer.
And on that point, will you just share that? You don't have to share the dollars per employee per month, but you offer a capitated environment for that virtual primary care. Just kind of talk a little bit about the fact that there's different ranges and there's different pricing, but even though you want people to use it, you are willing to do a capitation environment. Or
we do, yeah. And the way that we do is it's very flexible. And again, I think my competition out there does a great job as well. The way that we look at it from a capitated environment is this simple PEPM, or if it's a PMPM, either way. Do you want a $0 visit fee? We like $0 visit fees because we think that that's the last obstacle that you could take out of the way by making it easy for the patient to say, I don't have to come up with $25 or $45. It's $0. If I need to see someone, it doesn't cost me anything. But we also are able to do fee for service. We could do bundles of visits. We can do a lot of different things based upon what a particular model is being built by our advisors and brokers to meet that employer's needs.
awesome. One more, is there or will there be an opportunity to use Walmart systems to support or to help independent pharmacies and independent direct primary care doctors?
So the answer is simply yes. But again, I want to make sure I remind everybody that with our health centers, it's only 75 of them that we'll have at the end of the year. So because I I know we're all very excited about what happened with One Medical and then so many other great institutions, but they're not everywhere. And if you have dispersed employees that are dispersed, number one, or even if you have an employee base that lives in a couple of different towns, what we have found is that about 20 miles is about as far as anybody's willing to drive for a primary care visit because it takes so long, unless it's absolutely needed. So, the answer is yes. We already have some of those agreements that are growing and in place based upon the employers that are able to take advantage of it. When you think about the virtual primary care piece, that I personally think that from a delivery of service, there are so many people that just don't have a convenient way to get to a primary care doctor, and it's a really great excuse not to go. Or geez, I have to schedule out 3 months from now, who knows what's going to happen, and something happens and they have to wait for another 3 months. You can actually see a primary care doctor in under probably 2 weeks. You can probably get scheduled as quick as 72 hours in many states where we have additional providers.
Right.
That primary care relationship, because it's your doctor and you can call and set up an appointment with that doctor anytime. They can help you manage your well care or your chronic disease state. I think there's a great opportunity there for the individual employee and or their families to have that primary care access where maybe it doesn't exist.
Great. I'm going to open it up to anybody else who wants to jump on and just ask Jay a question. If nobody has any, I have a few.
Please
So,
go for it.
I liked what you said about your clinics are designed to really make cash pay easy. I truly believe that cash pay is a huge direction that we're headed in this country to really bring a marketplace into healthcare.
I agree.
Talk a little bit about just kind of Walmart's overall wanting to facilitate and help that cash pay environment grow.
Considering this, that we already have that transparency, so you already know what you're going to pay. If you wanted to find out before you even walked in, you can go to the individual health center and the pricing is there. We have a series of we have the charge master. We have a series of what we would charge for the various things that we actually do within those health centers, and contracting with employers who don't have a health plan but want to be able to cover their employees. I mean, literally, you can bring in a credit card. You can go buy a Walmart gift card. It works, right? And because when you start taking a look at what that cash paid price is, which is also what we also file as a claim, is that exact same rate. It just really shows that we're dedicated to keep this pretty simple. We keep it very transparent. We accept cash, credit, or gift cards. I don't know how much more simple that you can make than that.
Well, and you're familiar with the Forbes article that Dr. Pearl recently put out, which was an amazing article about the fact that transformation in healthcare is likely going to come from the Walmarts and the Amazons and these big retail organizations. Talk a little bit about the relationship between Walmart Health and Walmart's employees and this effort to really begin to transform healthcare, even with your own employees.
So, well, let's start off with the fact that Walmart, again, we actually have 2.1 million associates, but we have internationals or an international business. And what they have built, because there's so many, you can't just select a particular plan. But what they've built, and I can't talk about it too much again because of NDAs and what's public and what's not public, I would say is that our health centers are leveraged by our employees as well as the community. Our pharmacies, you can't find a Well, generally we don't pay for most things, and the drugs that have a little bit of a cost, you know, as long as we go to a Walmart pharmacy, it beats any other health plan and PBM card that ever had prior to coming to Walmart. Again, I talked about the centers of excellence. We spend a lot of time in investment in the associates to make sure that we're physically well, or mentally well, there's a lot of money when you think about the COE that we actually put somebody on a plane. We pay for that. We set them up in a hotel. We pay for that. We let them get their additional imaging or testing and second opinion visits. That's all paid for through the COE program, because we know at the end of the day, if they go through to these centers of excellence, they're actually going to have a much higher recovery or healing or just outcomes overall. So we're a huge believer in that, and the investment is just huge, but we think it's really important for our employees, and that's for all employees. Anybody that takes part of our health plan, that means the floor worker, the Walmart greeter, to anybody that works in corporate, they all have access to it.
Would it be fair to say that it's not just Dr. Pearl's idea that Walmart can have an impact on our country's healthcare, but it's a strategy of Walmart?
So the answer is yes. And I think that strategy is evident of the investment in putting in that executive staff of, you know, industry leaders, medical industry leaders. So we have folks like a Dr. Carmouche, who is, you know, well-renowned on value-based care. We have people who we put in place to drive a strategy, continue to build on that strategy and execute, knowing that we can't sustain what's going on in healthcare as it stands today. The conversations that take place with health systems has been interesting, because I think that everybody feels I don't know if it's the threat or the opportunity to figure out how do you do something different than the way we're doing it today, right? Because right now we're in a period of insanity, but the great work, again, of some of my folks that I have such deep respect for here, that they're trying to change the insanity to create something that's much more is much better for everybody. The work that, you know, again, that Jeff and Nelson's that are doing and working on, we need more of that. We need more people who are willing to stand up and try to go make a difference, because the louder our voices get, and I don't think you can get a louder voice in a Walmart for what we're doing. And that's why people do take notice. And it's like what you saw in the article and what Dr. Pearl said at the HCAA. If people aren't basically choosing to work with a Walmart or one of our other competitors in the marketplace, they're going to lose out. And I believe that.
Nice. Other questions that people have, please feel free to go off mute and ask your questions.
Hey, Jay, this is Jeff.
Hey.
It's great to see you.
Good to see you.
How do you plan to effectively compete with your other retail competitors? I'm thinking more in terms of CVS here and Walgreens, and I don't know who else you might want to mention. And how could and what are you doing to incentivize the independent brokers out there to, if they are going to choose a partner with significant presence in the community, why it should be Walmart as opposed to CVS or Walgreens or anybody else?
Well, first of all, we're not an insurance company, so I'll let you take that one off the table. We are in more places where others are not. So when you think about the footprint and the sheer number of people that are coming through our stores every day, can you imagine if you have over half of the United States population coming to a Walmart, what you could do to gain that recognition, to have that brand association, as well as the more partners that we bring in from independent advisors and TPAs and so forth, that bigger that voice gets, that, hey, we are interested in doing something different and can actually help to open up doors that are otherwise hard to even knock on. And by the way, and they're doing great work over at Walgreens. They're doing great work over CVS. So
Right.
I'm not knocking. I just, we're a bit of a different animal.
Yeah.
That's very gracious of you, Jay, to say that. Just put your tongue firmly in your cheek so we can see it. Thank you.
Thank you, Nelson.
Anybody else have any questions for Jay?
Jay, I think I asked all my questions when we were on stage at Ascend.
Yeah.
So I don't have any fresh questions.
Well, I thank you, but I love to get to meet more and more people and talk about what it is that you do and what your interests are. And yeah, my email address, I'll put it out to everybody so that you have it. So if you have any questions, if I can't answer it, I'll find someone who can. But I am a huge supporter of Daryl and the Aspirational Healthcare group and the work that Daryl's doing. I think those who know me know that I have a very strong conviction to change things, and the opportunity to come to Walmart allowed me to do something from inside, a voice that otherwise from the outside may not have gotten heard. Walmart's truly on a mission, and we're committed. Again, I'm going back to it. Save money, live better. And we're applying that. We do our best to try to apply that every day and help them on this.
Well, and I'm going to open up one more time for questions, and I'd like to kind of just end things with another final question. But anybody else have any questions? So Jay, you know that the two fundamental principles of the aspirational model is one, relationship-based healthcare, which has been proven over and over, relationship trumps science. And the other one is continuous quality improvement, which exists in every industry in this country, with the exception of between employers and the healthcare system. It's the biggest void in this country. And this may be a rhetorical question, but I see what Walmart Health is doing with what you just said directly tied to what most employers want and why they buy healthcare benefits. It's like CQI is about define your business objectives, measure to see if you're accomplishing them, align the system to work for you. And what you just said as your mission objectives for Walmart Health are like the top objectives of business. So there's a perfect alignment between your strategy and what we're trying to get employers to wake up and do. And that is to say, simply define what you want and define why you buy healthcare, and then measure to see if you're getting it. And the more you measure it, the more you'll open up to ideas like Walmart Health to help you accomplish it. I know it's a rhetorical question, but anything to add to that?
Well, you've spoken as a CEO of major institutions, so thank you, Daryl. I think the one measuring tool that is incredibly important to us is our Net Promoter Score, the NPS scores. The only way that you really know that you're doing well is because your patients, your customers, your clients are telling you that you're doing a great job. Because they'll so this goes back to my days when I worked for Philips, which is this: if you're treating people really well, they generally will tell a couple of their friends, or if someone asks them for a recommendation, they'll make a recommendation, but they're not out there, yay, we love, but if you do something wrong, I had to be careful because of everything that's been going on recently. They become terrorists. They want to take you down. They're getting on every social platform they can get on to tear you down. The Net Promoter Score is a way to help capture how people feel about you. And with our Net Promoter Score, just like with our pharmacies at 77, it's unheard of.
That's
It's unheard of for pharmacy, let alone most other places. So we feel like we're not done, and I don't know if we'll ever be done at continuing to perfect what those offerings are going to be and how do we move forward, because healthcare changes and technology changes, but at this point we do want to be a part of, again, the solution.
Nice. Well, thank you, Jay. I really appreciate it. Thank you so much for the presentation today. Thanks everybody for jumping on. Our next meeting will be in 2 weeks on April 28th. And we hope to see you back then. And we wish you a wonderful weekend.
And thank you, dear, for the invite. Good to see everybody.
Thank you.
Great to see
Thank you.
everyone. Enjoy
Thank
your
you.
weekend.